Hi everybody, it's Emily here to talk about week 8's readings. These readings were really interesting, specifically about access to care for different sexual and gender minorities. The differences in access to health insurance with the legalization of same-sex marriage was really interesting to talk about, because it increased coverage for same-sex couples, which, leads to an increased ability to access healthcare, which is necessary. But in Elton's paper talking about cohabitation, married adults are more likely to have health insurance, which we figured given our health insurance system in the US, but married adults also had socioeconomic factors that contributed to financial and health stability, including being white, having higher income, maybe having children in the house, and more education. So the ability to be accessing marriage or get married and increased health care and access to care is likely also connected to these socioeconomic factors rather than just being able to get married. And it suggests that an intersectional perspective is needed here to figure out, is this a confounding factor, or is this specifically the ability to get married affecting access to care, or if it's a combination of both. And it was really interesting that Elton's paper also brought up biphobia. Specifically, double discrimination affects poverty and cohabitation rates in bisexual individuals, which I have seen firsthand as a bisexual person in a long-term relationship with another bisexual person. And I've heard it from friends. There's a tendency for you not to be either straight enough or queer enough, so you're kind of isolated from both communities in a way, despite the people you're dating or in relationships with or associating with. Let's see. And then the McNeil paper brought up lack of knowledge and heteronormative attitudes, increased discomfort, the disclosure of sexual orientation and judgment, all affecting health outcomes for LGBT individuals. Being uncomfortable with your healthcare provider leads to ineffective care in many cases, or if your healthcare provider is not trained or uncomfortable with LGBT individuals, that also is a problem. Hostile and unwelcome attitudes from providers make it much worse. And the paper from McNeil talked about the use of the dyke slur from a healthcare provider toward a patient, which is unacceptable. And then the video we watched I thought was really interesting. It was talking about how rural areas are notoriously less safe for LGBT individuals, despite them being still living in those communities. They're from those communities, their families are there, of course they're going to be there. And this brings up the increased need for intersectionality I brought up a minute ago, where even in areas that might require you to be maybe hiding your sexuality more, caring for your safety more, there should be more training in healthcare spaces to cater toward these types of patients. And then the Schneckenberger paper on asexuality was really interesting. You don't necessarily hear asexuality being talked about in these discussions, despite it causing its own unique set of problems, similar to the biphobia problem. Asexuality is unique, and I've heard from asexual people that I know it is a lot more difficult to find romantic partnerships if they're asexual but still seeking romantic partnership. Or even if you're aromantic, also, if you don't want to be romantically or sexually involved with somebody, it can lead to not getting married. It can lead to issues getting insurance because of that, because again, our healthcare system is set up and our insurance system is set up so that you're generally getting it through your work or spouse. And I also wanted to bring up, it was interesting, it brought up this spectrum of asexuality and how demisexuality is also difficult, especially because of today's hookup and dating culture with dating apps, hookups, etc. And they too face bias from non-sexual gender minorities and sexual gender minorities due to this lack of sexual desire or spectrum of sexual desire. So I thought it was a really interesting week for content, and I know I'm running a little long, but I hope you guys enjoyed. Bye.